Hello and welcome. Today, we're going to discuss one of the most pressing health concerns for adults over 60, high blood pressure. It is a condition often called the silent killer, and for good reason. For the vast majority of people, it arrives without any symptoms at all. You can feel perfectly fine, while inside, a quiet pressure is building, placing strain on your heart, your arteries, and your vital organs. I understand that living with this concern, or the worry of developing it, can be a source of constant, low-level anxiety. It's a number on a cuff that can dictate your day, your diet, and your peace of mind. But what if you could reclaim a measure of control? According to the work of the nation's leading cardiologists, there are powerful, evidence-based strategies that go beyond medication alone. Today, I am going to share a key insight from their clinical experience. We will explore the science behind the #1 drink that has been shown to lower blood pressure in minutes. But more importantly, I will reveal the single, unifying principle behind why it works. A principle that, once you understand it, will empower you to manage your cardiovascular health in a way you may have never thought possible. Before we can build a solution, we must first clear away a common and dangerous misconception. Many people believe that if they feel healthy, they must be healthy. A top cardiologist I've spoken with says this is the single most challenging belief he encounters in his practice. He calls it the wellness illusion. Because high blood pressure is typically asymptomatic, feeling fine is not a reliable indicator of your cardiovascular health. And it's perfectly okay to find that information unsettling. It can be frightening to learn that your body might not send you a warning sign for such a serious condition. But what I want you to remember is that this knowledge is not a reason for fear. It is the first, most critical step toward empowerment. Let me share an illustrative story from this cardiologist's experience. A 68-year-old gentleman came in for a routine physical. He was active, maintained a healthy weight, and had never smoked. By all outward appearances, he was the picture of health. He felt great, but the blood pressure cuff told a different story. His numbers were dangerously high. He was shocked. He said, "But doctor, I feel fine. How can this be?" This cardiologist sees this pattern every single week. He observes that the most diligent people, those who exercise, eat what they believe to be a healthy diet, and avoid obvious vices, are often the ones most surprised by a high blood pressure diagnosis. They are doing so many things right, but they are blindsided by the silent nature of this condition. This gentleman's story is not an outlier. Now let's move from diagnosis to action. The first strategy is not a pill or a supplement. It is a tool you already possess, and it is profoundly powerful. It is the conscious control of your breath. To understand how this works, we need to look at our body's own internal control panel, the autonomic nervous system. This system has two main branches. The sympathetic system is our fight or flight response. Slow, deep, controlled breathing is one of the most direct ways to activate the parasympathetic system, stimulating a critical nerve called the vagus nerve, which sends calming signals throughout the body. The most effective technique is called diaphragmatic or belly breathing. Here is how you can begin. It's often easiest to learn this while lying on your back with your knees bent. Place one hand on your upper chest and the other on your abdomen, just below your rib cage. Now breathe in slowly and deeply through your nose. Your goal is to feel the hand on your belly rise, as if you are inflating a small balloon in your stomach, while the hand on your chest remains as still as possible. Then, exhale slowly through your mouth, feeling the hand on your belly gently fall. For beginners, a wonderful starting point is to practice this for 5 to 10 minutes, perhaps once in the morning and once before bed. A common mistake is to heave the chest up and down, using your shoulder and neck muscles. The key is to isolate the movement to your diaphragm. The hand on your chest is your guide. I understand that focusing on your breath in this way can feel unnatural at first. It might even take some effort. Be patient with yourself. This is a skill, and with gentle, consistent practice, it will become second nature, a reliable tool you can use anytime to bring your body back into a state of calm balance. Our second strategy is one that may surprise you. It comes from the field of exercise physiology and has been shown in some major studies to be even more effective than traditional aerobic exercise for lowering systolic blood pressure. It's called isometric hand grip training. This is a form of static exercise where you contract your muscles without any significant movement in your joints. The mechanism behind its power is fascinating. When you squeeze a hand grip, you temporarily compress the blood vessels in your forearm, restricting blood flow. When you release the grip, blood rushes back into the area. This sudden surge stimulates the lining of your blood vessels, the endothelium, to release a powerful vasodilator called nitric oxide, which tells the vessels to relax and widen. Now, a common question that arises here is, how do I perform this correctly? The studies mention squeezing at 30% of your maximum strength, but how can I measure that at home? This is an excellent question. You do not need a fancy laboratory device. Think of a 30% contraction as a moderate squeeze. You can use a simple stress ball or a basic adjustable hand gripper. The effort should feel challenging, but you must be able to sustain it for a full 2 minutes without shaking or sharp pain. You should be able to carry on a conversation while you are squeezing. This brings us to a point of failure for some, and it is one we must address with the utmost seriousness and compassion. This exercise is not for everyone. Because it causes a temporary rise in blood pressure during the contraction, it is not recommended for anyone with uncontrolled hypertension, meaning a systolic pressure consistently over 180, or other unstable heart conditions. It is absolutely mandatory that you speak with your doctor and get their clearance before you begin this type of training. This is not about being overly cautious. Let's pause for a moment and synthesize what we've learned. We began by understanding the silent, deceptive nature of high blood pressure. Then, we introduced two powerful, science-backed strategies to take back control: using your breath to calm your nervous system and using isometric exercise to improve the health of your blood vessels. It is important to see how these are not separate ideas, but a system. They work together synergistically. The slow breathing helps shift your body into a parasympathetic or rest and digest state. This state of calm makes your blood vessels more receptive to the vasodilating signals like nitric oxide that are stimulated by the hand grip exercises. A calm nervous system and healthy, responsive blood vessels are two sides of the same coin. You have already learned two profound concepts that put you in a position of power. I want to commend you for your attention and for investing this time in your well-being. But what about the promise from the beginning? The #1 drink to lower blood pressure in minutes. The strategies we've discussed are for building long-term resilience. Now, we turn to the science of rapid results. And what we are about to uncover is not just a simple beverage, but the powerful mechanism that makes it work. A mechanism that holds the key to the entire system of blood pressure control. The title of this video promises a drink that can lower blood pressure in minutes. And the scientific evidence points squarely to one candidate that can deliver on this acute, rapid effect: beetroot juice. The reason for its speed lies in a remarkable biological process called the nitrate to nitric oxide pathway. Here is how it works, in simple terms. First, you consume beetroot juice, which is naturally rich in a compound called dietary nitrate. Second, beneficial bacteria that live on the surface of your tongue convert that nitrate into a new compound, nitrite. Third, this nitrite is swallowed, absorbed, and circulated throughout your body, where it is converted into one of the most important molecules for your cardiovascular health, nitric oxide. Nitric oxide is your body's own master vasodilator. It sends a powerful signal to the smooth muscles lining your arteries, telling them to relax and widen. This widening allows your blood to flow with less resistance, and your overall blood pressure goes down. One landmark study found that a single dose of nitrate-rich beetroot juice lowered a key measure of blood pressure by over 5 points within just 30 minutes. So what should you expect if you try this? It's important to manage expectations. This is not like a cup of coffee. You likely will not feel a sudden jolt or a dramatic physical change. The process is internal and chemical. It's a quiet, powerful relaxation of your vascular system. You should also be aware of a harmless, though sometimes surprising, side effect called beachuria, which can turn your urine and stools a reddish color. It's completely normal and temporary. So we have arrived at our answer. The number one drink to lower blood pressure in minutes is beetroot juice. But a leading cardiologist would tell you that to stop there is to miss the most important lesson. The beetroot is just a delivery system. The juice itself is not the magic bullet. The true secret, the unifying principle that ties everything together, is nitric oxide optimization. This is the grand finale. This is the transformation from simply following advice to truly understanding your own body. Beetroot juice is one way to boost nitric oxide, but you have already learned others. That slow, deep nasal breathing we discussed? Your nasal sinuses are a major factory for nitric oxide production. Breathing through your nose carries this gas directly into your lungs, where it improves oxygen uptake and relaxes blood vessels throughout your body. In fact, simply humming while you exhale through your nose can increase the release of this nasal nitric oxide by an incredible 15 times. And the isometric hand grip exercise? Its primary long-term benefit comes from stimulating your endothelium to produce more of the same crucial nitric oxide. So while beetroot juice is the fastest way to get an external dose, the ultimate strategy is to support your body's own ability to produce and utilize nitric oxide. This is the principle that makes all the other strategies work together. And for the most powerful sustained effect, the evidence points to a different beverage, hibiscus tea. Meta-analyses show it can lower systolic blood pressure by an average of over 7 points. So how do we put all of this together? Think of it as a clinical action plan, a toolkit you can adapt to your life. First, the foundation. Master diaphragmatic nasal breathing. Aim for 5 to 10 minutes, twice a day. This is your baseline for calming your nervous system and optimizing your body's own nitric oxide production. Second, for a long-term strategy, consider making 1 to 2 cups of hibiscus tea a daily ritual for its potent, sustained benefits. Third, for a targeted boost, especially if you need a more rapid effect, a standardized, high-nitrate beetroot juice product can be an excellent tool. And fourth, if you have been cleared by your physician, integrate isometric hand grip training 3 times per week to strengthen and improve the function of your vascular system. Please hear this clearly. This is not a rigid all-or-nothing prescription. It is a set of options. The goal is not perfection, Thank you for dedicating this time to understanding the intricate workings of your own body. It is a privilege to share this evidence-based information with you. I would be honored if you would share in the comments below, not your personal health numbers, but your experience. Which of these ideas resonated most with you? What is one small step you feel empowered to take this week? Your journey and your insights can be a source of inspiration and encouragement for someone else reading this. Remember, knowledge is the most powerful tool you have. Use it wisely, use it with compassion for yourself, and take control of your health. If you found this information valuable, please like this video, share it with someone you care about, and subscribe for more in-depth guidance to support your well-being.